Hello, everyone. This is Professor Marvel, and this is a concept recording for week 6 content and concepts. So, week 6 will be covering occupational health, environmental health, barriers to learning, and reinforcing health education. I'm going to share my screen and bring up our week 6 PowerPoint that is part of your announcements for this week. So here are the concepts covered. As I said, occupational health, environmental health, barriers to learning, reinforcing health education. So what is occupational health? Occupational health focuses on workplace settings. Okay. So if you are a nurse working in an occupational health role, you are working in a work environment. What do we do? What do occupational health nurses do in the workplace? Well, they do workplace assessments. What that means is they learn about jobs, job descriptions in the workplace. They learn about what employees need to do to keep themselves safe. What training do they need to keep themselves safe? What materials are in the workplace that potentially could be hazardous? What are the job requirements? Um, an occupational health nurse also may look at potential injuries and or um, diseases that or comorbidities that are brought into the workplace, and how do you help people manage those with chronic illnesses? Let's say employees have diabetes, or employees have severe allergies, they have EpiPens, they have insulin. Occupational nurse needs to know that so that she can help employees stay safe with their health issues, as well as stay safe with regards to their job descriptions. What are the potential hazards of the job? What are the work practices of employees? Right? He or she also should be observing for effectiveness of safety education and equipment. Are employees using the training, the safety training they received? Are they using the equipment properly, thus to minimize injuries or accidents? We talked a little bit about knowing about various injuries and diseases acquired from employment, right? We know that every single industry has serious hazards related to work. There is no real safe industry to be working in. Okay. Occupational health nurses may work as educators to teach. They may work as case managers to manage employees that maybe have been injured on the job. Okay. We'll talk more about that in length during class. Okay. Occupy a few other talking points about occupational health nurses. Case management, we talked about. Case management is a big role in occupational health. Let's say somebody gets injured on the job. Well, they're going to have to work with the employee, human resources for whatever kind of leave the employee needs to take, following up with doctors to find out when the employee can return to work. Can they come back on limited duty? What adjustments need to be made? What education needs to happen? If let's say their injury was due to, let's say, lifting, they had a back injury. They lifted something that was too heavy. Do they need re-education on proper body mechanics and how to teach? Okay. A lot of employees may need counseling and crisis intervention for maybe issues that are going on outside the workplace. The occupational nurse is also involved in this, providing resources for counseling and crisis intervention. Another role is health promotion and risk reduction. Okay, there's lots of legal and regulatory compliance guidelines that have to be met in the workplace. Okay. When we talk about legal and regulatory compliance, we think of OSHA, the Occupational Safety and Health Administration, right? These are laws and guidelines that affect the workplace. Okay, one example of this is the Family Medical Leave Act. Okay, another example is HIPAA. Okay, the Health Insurance Portability and Accountability Act, right? Occupational health nurses need to make sure that places are in compliance with these. Okay. Here's some examples of primary, secondary, and tertiary preventions regarding occupational health. So remember, primary is prevention. So an occupational nurse may teach coping mechanisms, provide healthy diet education, maybe educate on the use of ergonomic lifting, protective equipment. Secondary is screening. So maybe they are screening for hearing loss. Let's say you're working in a plant that's very loud. Okay, there needs to be screening for hearing loss or potential hearing loss. There may be screenings for blood pressure, screenings for stress and burnout. And tertiary would mean that something has happened. There's been an injury, an accident, and as we talked about, the occupational health nurse would need to look at limited duty programs of employees returning to work, right? Let's say you have employees that have chronic illnesses. Maybe they're providing illness or injury specific education. And the example here is the use of a wrist splint for an employee that has carpal tunnel, or the use of a back brace for an employee who's had an injury to the back or who has chronic back issues. So occupational nursing is all about the workplace, keeping the workers safe and keeping them educated on how to perform their job duties safely, thus to minimize injuries and risk. Then environmental health. You think about the environment you live in, the community you live in. You think about all of the different environmental risks that are posed. Okay, we know that environmental hazards are responsible for over 1/2 of the total burden of diseases in the world and actually contribute to 80% of communicable and non-communicable diseases and injuries. We know that children are much more vulnerable to environmental hazards. We know that environmental health can be determined by a combination of genetic issues, socioeconomic status issues, and environmental exposures. Okay, those who live in poverty are much more likely to be exposed to, say, hazardous wastes if they live closer to a hazardous waste site. Maybe having poor quality foods available, maybe living in older homes with lead-based paint exposure. So when you're doing an environmental risk assessment, here's the important information you need to gather. Where do people live? What's their dietary history? What is their housing? Are they exposed, potentially at increased risk for exposure to lead-based paint? Are they exposed to pesticides? How is their drinking water? What is the air quality? The most common environmental risks have to do with pollution, contaminated water, contaminated soil. If you just think about your own community, do you know what the environmental risks are in your community? Right? We know that children, like I said, have higher risk to environmental issues. Children are more sensitive. Children exposed to environmental risks may have an increase of childhood cancers. They have underdeveloped livers. Children can be immunocompromised. They breathe faster. They consume more food. Okay. Think of everything you have in your home with regards to environmental risks, with supplies, cleaning supplies, gardening supplies, pesticides, herbicides. It is estimated that 30 million Americans drink water that doesn't meet the EPA standards. Remember the EPA, the Environmental Protection Agency. Okay. They oversee all of the environmental risks in all of our communities. They estimate that over 30 million people drinking water do not meet the EPA's safe drinking water standards. It's also estimated that 50% of Americans live in areas where air quality does not meet national standards. And then we know about food contaminants. Food contaminants include pathogens like salmonella in chicken, E. coli in beef and your greens, pesticides, antibiotics that are put in crops. So there's a lot of environmental risks. Okay. We'll talk more about those when we get into class this week. Let's go to barriers to learning. One of our biggest roles in community nursing is education. Okay, we know that patient education is one of the most important roles of a nurse, right? We use education to promote health, prevent illness, injury, improve healthy related behaviors, right? And we also teach to enable patients and their families to care for each other and themselves with their health conditions. We know that when patients take personal responsibility for their health, they're much more effective in making the changes necessary to move towards improved health, right? We know that education empowers our clients with knowledge and motivation, helps them take personal responsibility, right? As nurses, we're essentially educating in really every role we're in, right? One of the most important learner-related barriers is low literacy. Okay. As nurses, we often deal with individuals and populations who are illiterate or have low literacy skills. Maybe they're embarrassed to admit they can't read or comprehend what you're trying to teach them. Okay, so that is a key point, low literacy, right? Culture also plays a role in education. All right, a lot of different cultures have a lot of different ways to receive and understand education. Okay, language, is there a language barrier? Okay. We have to be able to assess a client's readiness to learn. And we know that motivation plays a large role in effective learning. Some barriers to learning. Are they ready to learn? Are they motivated? How do their culture and values, how is that going to impact how they receive your education? Also, personal expectations and experiences. A lot of clients have a lack of self-confidence to be able to carry out the plan for what you're teaching. It's always important to support, to praise, and to encourage. There's a couple of different ways of learning, and domains. Okay, so visual learning, there's 3 different types of domains: visual, auditory, and kinesthetic learning. Visual is you learn best by seeing something, auditory by hearing something, kinesthetic by practicing hands-on. Okay. We all possess ways to learn cognitively, affectively, and psychomotor. All right, we all possess those, but usually one of those is dominant. Okay. Cognitive, if you are a cognitive learner, that's the thinking part, right? You have the ability to hear the information or read the information, understand it, memorize it, and then use it to solve problems. If you are primarily an affective learner, that's the feeling part of it, right? What are your attitudes? What are your feelings? What are your beliefs? What are your values? How do they affect your ability to learn? And then psychomotor. Okay, that's the moving part. That's the doing part. That's learning a skill or task through practice and experience. That's the teach back method, right? So you have the ability to practice and perform the skill. So for example, if you're trying to teach a new diabetic how to use a glucometer, okay, it's best to teach them and then have them practice over and over again, the hands-on method. Okay. If education doesn't address all 3 domains that we just talked about, cognitive, affective, and psychomotor, you will not be nearly as effective, right? Telling somebody to change without motivating them to do so or providing them with the skills necessary, it's not effective. Okay, so how do we reinforce health education? Well, it's certainly essential that when we're developing patient education, right, it's done collaboratively with everybody who's going to be affected, with all the disciplines involved to improve patient care. Okay, so if you have somebody that has a complex chronic illness, and you're trying to do discharge teaching in preparation for them to go home, who needs to be involved? What services need to be involved? There needs to be a collective group planning for this patient's discharge. All right. Whatever the plan you come up with needs to be agreed by the client. Right? The ultimate goal of patient education is the prevention of illness, promotion of wellness, restoration of health. So we teach patients about their disease or disorder. Maybe we're prepping them for surgery. Maybe we're teaching them what the plan is for home care once they get home from whatever they're being whatever they have, illness, injury, new diagnosis. We have to be able to self-assess if there's a knowledge deficit. How do we know the patient is hearing our teaching, understanding our teaching, and can carry out that plan? We all know that discharge planning starts at admission, right? We know that discharge planning requires us to look ahead to meet the patient's ongoing needs at home. Okay, what special needs, what resources are they going to need? And here's some examples of primary, secondary, tertiary with regards to patient education. So an example of primary, teaching women to go to the bathroom before and after sex to prevent cystitis, teaching patients how to role model healthy eating, educating parents on immunizations. Secondary, maybe you're teaching an elderly woman the signs and symptoms of a UTI, helping them with self-screening because they're at risk, providing education on preparation for colonoscopy. Tertiary, somebody, you need to have something, diagnosis, illness, injury. So maybe we're teaching a low sodium diet to clients with hypertension, demonstrating the use of a glucometer with a diabetic. Okay. Even discussing potential side effects for medication that have just been prescribed. Those are all those are examples of tertiary. And some important tips about education. Learning really has not occurred until the behaviors changed. We know the behavior changes are hard. We, as humans, like to take the path of least resistance. All right, so change is a cyclic process. It's hard. It's hard to change behavior. Okay, but we as nurses play a really important role in that. Okay, patient education is one of our biggest roles. So we'll talk more about all these concepts. That's just a quick overview of the four of them. We'll talk more about them in this upcoming week. Okay? All right, thanks.